All right. Thank you very much to everyone for the opportunity to share our work and for all the important work that's been done so far over the past few days. My name is Jason Marwaha. I'm a general surgery resident and completing a postdoctoral fellowship in informatics. And the title of our work is Open Science Practices in Surgical Journals and Surgical Research. So, as you know, as everyone sort of has been reiterating many times over the past few days, reproducibility and transparency of research are core tenets of this conference, and of course of all medical research, and ongoing retractions of studies in several medical journals, particularly over the past few years, continue to underscore the relevance of many of these issues today. Beyond, sorry, there we go. Many tools more broadly in academia now exist to promote research quality and transparency, and are used frequently in many other non-medical fields, including protocol pre-registration, reproducibility and transparency reporting guidelines for most common study types, preprint servers, and many other resources that have been discussed in prior sessions during this conference as well. The PLOS network of journals, as you see here, does a very nice job of highlighting these currently available open science practices and encourages authors to utilize them both before, during, and after submission. However, the extent to which the surgical research ecosystem in particular has adopted these tools is unknown, and as a team of mostly surgical researchers, we sought to answer this question. So the purpose of this study was to measure the use of these quality promoting open science practices in surgical research. And I'll just add, for a bit more context, the motivation behind the study was that many of the authors on this study work in a lab that implements and pilots new informatics and digital health tools in clinical workflows for physicians at an academic medical center. And it's often very difficult to reproduce and implement tools that aren't described fully in their original study. And so we sought to see if open science is being used at all in the literature that we depend on to do our work. And so to do our study, we included the top 8 surgical journals as defined by their journal impact factor as defined by Clarivate Analytics. We selected a random sample of 240 original research articles published from 2019 to 2021 from these journals to include in our final cohort, and we ensured that we included 30 studies from each journal, so each had equal representation in our final cohort. The number of journals that explicitly endorsed these practices and their author submission guidelines was measured, and the number of original research studies that explicitly used these practices was also measured. And the 8 journals we included in order of descending journal impact factor are listed here. And we measured the use of 5 open science practices in surgical journals and manuscripts. And those 5 open science practices were preprint publication, the use of reporting guidelines, such as those endorsed by the Equator Network, study protocol pre-registration prior to peer-reviewed publication, published peer review, and public accessibility of either the data or experimental methods or code for a study. And of note, we made a distinction between pre-registration of clinical trials on established trial registries, such as clinicaltrials.gov and many of the other resources that prior presenters have referenced. We distinguish that from the more emerging practice of pre-registering outcomes and analytic plans for other types of studies, such as observational studies on newer platforms, such as protocols.io and the Center for Open Science. So I'll start by sharing what journals typically recommended in the surgical research ecosystem when it comes to open science practices. So in their author guidelines, 7 of the 8 journals we examined recommended compliance with reporting guidelines prior to journal submission. 5 of the 8 journals explicitly stated that they allowed for submissions to have been previously released as preprints prior to submission. Only 3 recommended that authors pre-register the protocols for non-clinical trial type studies. Unfortunately, none of the journals offered the option to publish peer review comments. And 5 explicitly recommended that their authors make their methods publicly available, including all code, experimental protocols, and data if possible. And now I'll share what we found with regards to the studies themselves and their use of open science practices. So across all of the 240 articles included in our final cohort, 27% of them explicitly complied with an appropriate reporting guideline. Only 17% of the observational studies we examined pre-registered their study protocols. Pre-registration of clinical trials was higher, as unsurprisingly higher, presumably because there's already a robust infrastructure for doing so. None of the articles in our cohort were posted on a preprint server prior to journal publication, and only 6% of them fully disclosed their methods in the form of making their code public or publishing a separate protocol or experimental methods paper. We also noted some interesting trends that aren't highlighted in this table. So journals, perhaps unsurprisingly, journals that recommended compliance with an open science practice saw higher levels of open science practice utilization in their published research compared to journals that did not mention the practice at all. So journals that recommended compliance with an open science practice guideline saw on average 18% utilization in their published papers versus 4% utilization in others. Unfortunately, none of the journals explicitly required compliance with any open science practice. And there was also a significant positive association between journal impact factor and utilization of open science practices in its published studies. So overall, only 31% of surgical research articles in our study made use of at least one open science practice, meaning that 69% of them used 0 open science practices. This, of course, may leave the field potentially vulnerable to poor research quality. And this study, of course, has some important limitations. First, it's entirely descriptive, and there's no open science utilization benchmark from other fields in medicine to compare it to. So it's unclear as to whether surgery is sort of doing better or worse than these other studies. And finally, a journal's limited compliance may have unfairly affected a paper's ability to comply. So for example, if a journal does not offer publication of peer review as an option, then the authors have no way to exercise this practice. And overall, there are many opportunities for improvement of the use of open science practices in surgical research. Thank you.
Well, thank you very much for this interesting presentation. I don't see anyone at the microphone. Someone's coming there. Please go ahead, Anna.
Anna Marušić, Croatia. Thank you for the study. It's really interesting to see the surgical field. I wonder if you can relate these results to the specific nature of surgery research, because in contrast to pharmaceuticals, which are, RCT is the main way of testing it in surgery, innovation in surgery goes completely the other way, where you have a single case series and so on. So the question of data sharing in such a research field is also, has a different meaning perhaps to it. So I wonder what your opinion is.
Yeah, thank you. That's an excellent point. I agree that I don't have data to support this, but my sense is that the distribution of study types across the surgical literature as compared to other areas of science is probably very different. And I think that probably has an influence on how easy it is to make data available, code available, and sort of utilize some of these other practices. Anecdotally, I think that at least in my experience at large academic medical centers, a large share of surgical literature that's produced tends to be retrospective observational studies. The most common type of study that we came across sort of in our cohort were retrospective observational studies from single academic institutions that wanted to look at their experience with some specific type of surgery and outcomes, or some specific kind of intervention and how that affected postoperative outcomes and things like that. So I agree that the distribution of study types likely sets this field apart from others. How would, you know, measuring the degree of that influences, yeah, I don't have an answer for that, but I imagine, I agree with your hypothesis that there probably is.
Okay, there is an online question I see. Please go ahead, Michael.
Yeah, one comment and one question. Bahar Memani from Elsevier has a clarifying comment, presumably for two Elsevier journals. Two of the journals in your research piloted publishing peer review, but due to the logistical problems of the partner publisher, couldn't upscale it. And Ian Hirnashkovich of PLOS asks, why did you select those 5 open science practices to assess? Why did you consider data code methods to be 1 rather than 3 practices?
Both excellent questions. So to the first point from the about the Elsevier journals, yeah, I mean, you know, it's hard to ascribe low compliance with one particular practice to just journals or to just authors, given the complexity of the research ecosystem. You know, as I mentioned, you know, just because we saw low compliance amongst in the literature, in the surgical literature for published peer review, that it's not an indictment of authors by any means, especially if they're not given the option to do so. And of course, the same goes for journals if there are other sort of confounding factors that influence their ability to offer certain practices or not. As to the second point, from the representative from PLOS, so we actually used PLOS as sort of a North Star in designing this descriptive study, and to particularly focus on the point of data / experimental methods / code sharing. We lumped them all together because of the constraints around PHI sharing in surgical literature. We understood that it's not always possible, and we didn't want to hold that against the authors. And so we kind of lumped it together with sharing code and sharing other elements of the analysis to sort of give them credit for the fact that they were trying to at least make their analytic approach available to others.
Thank you. We go to the microphone in the back. Please go ahead.
Yeah, hi, Alexandra Winter from Merck Manuals in University of Pennsylvania. Thank you for the study. I was wondering, how did you assess adherence with the reporting guideline? Did you do this by just simply seeing if they uploaded the checklist or whether they had included a flow diagram? And then, so that was the question, and I just had a comment.
That's an excellent question. Yeah, so just to offer some clarifying detail, some important clarifying details. So we assessed compliance not by sort of scoring the paper against the reporting guideline itself, but instead seeing if the author's intent was to comply with the guideline from the beginning by seeing if they mentioned it in their methods or attached a checklist or something like that. And I think that the reason why we settled on that sort of definition was because it's possible that, you know, an amazing study sort of inadvertently was fully compliant, but we wanted to give credit to the authors who acknowledged the importance of it enough to make it a part of their approach.
So even if they just mentioned it, but they didn't include a flow diagram or a checklist, that would count as complying?
Yeah, so yeah, yes, and it's a fair limitation, but if they mentioned it and mentioned that the study was you know, was compared against the you know, reporting guideline X prior to publication and was fully compliant, then we would give them credit for that.
And then just really quick, you've probably seen there's a study by Rice and colleagues in BMJ, just I think 2020, with a commentary by Hal Sox that talk about part of it just goes to incentives. That I think only 3% of the institutions they study really awarded anything related to open science. So I think that's the battle we have, is to encourage people to do this, because the traditional criteria don't encourage people to do any of these things. So,
agreed. Thank you.
Thank you.
This gives me the opportunity to ask you, that there is some room for improvement. I guess we can agree on that as far as open science practices are concerned. And one of your conclusions is that we should promote it a little bit better. shouldn't, how would you do that? How can we be effective? Should it become mandatory? Should we enforce it? Should we check it? Or are there more subtle ways to improve these things? What are your thoughts on that?
That's an excellent question. And I think it goes back to the idea that sort of just identifying the problem in the data is not tantamount to solving the problem. You have to sort of act on it as well. And I think one easy, I think, way for journals to do this, and I want to be clear that I think the responsibility to do this falls on both journals and researchers, not one or the other. But I think what an easy early step it would be to journals should be doing their due diligence by, as PLOS does, strongly encourage, listing it in author guidelines and making resources available and strongly encouraging authors to utilize the resources that they make available to them prior to submission. We did find in our data that the more the journal recommended an open science practice, the more likely the authors were to use it. So I think that's an easy early start. As you know, I mean, and I don't know that I would go so far as saying that these types of practices should be made mandatory, especially if it's not possible for a study to comply for whatever reason. But I think an easy early start would be to ensure that journals at least do their part by strongly recommending authors to comply.
Thank you. Thank you again for your presentation.